Hello everyone, thanks for watching today's video. If you like to know more about human body and how diseases work, then please remember to subscribe and click the bell icon for my weekly uploads. Today I'm going to talk about a very common condition called anal fissure. In my last video, if you remember, I spoke about hemorrhoids and I mentioned in it very specifically. Many of us believe that hemorrhoids cause pain in the bottom end together with bleeding. But the commonest cause of painless bleeding in the bottom end is hemorrhoids. The commonest cause of pain in the bottom end, which is like sharp glass like pain, is anal fissure. So main symptom of anal fissure is pain in the bottom end when we go for the poo, and also because it's a cut inside the bottom end, because anal fissure means a split or a cut inside the bottom end, it can also bleed streaks of fresh blood on surface of our poo. Now this is, I've drawn the anatomy of the anus, the way I understand it. It's that in the middle is our anus, which is the bottom end. That's the opening in the bottom end, and that is the tissue around that we can feel when we are cleaning ourselves. In the red and the green, I have drawn what we call the sphincters. Now these are the muscle which, if this is the anus, there are muscles around it which helps us squeeze the anus, keeps it shut. When these muscles become damaged or too weak, then we can't keep the anus shut and it becomes too loose. So these muscles are part of the pelvic floor muscles. So if you know what pelvic floor is, pelvic is like a basin, our pelvis is like a basin, so it's like a wash basin, and at the bottom of the wash basin there is usually a hole through which the water goes out, and that hole is, say, presume is the anus, and the ring around that hole is the muscle, and that the basin that we have in the wash basin, the floor of it is made out of very strong muscles, and we all have those muscles in our bottom end, and that is what supports our bottom end, the rectum, and our front bits as well. So in the ladies, the vagina, the uterus, and everything else that goes with it. And if it becomes very floppy, very saggy, and the muscle becomes weak, then controlling the bottom end and the front can become very difficult. And people either leak poo, or when they sneeze or cough, they wet themselves, their underpants, and that is a very common problem when these muscles become very weak or stretched out for whatever reason, from childbirth, from damage from surgery, from age, etc., etc. So I've drawn two muscles. One is the internal muscle, which is called the sphincter, and one is the external muscle, which I've drawn in green. So the internal sphincter I've drawn in red, and the external sphincter I've drawn in green. And there are two sets of muscles around the anus which squeeze it tight. But if you look at the front of it, where they crisscross, and the back, so at 12 o'clock and 6 o'clock they crisscross, and this becomes a weak point here where they're crisscrossing. And sometimes when our stools are very hard and they stretch the anus, or we are straining too much because we have too much loose motions, or sometimes the blood flow down there is quite difficult, or sometimes people sit on the toilet for a long time because they can't empty their bottom ends, and people who have pelvic floor weakness, they feel that way. Then at these weak points over here, the internal lining, because it stretches, it splits. So that split in the bottom end, in the front or the back, those are the commonest sites where we get it. The commonest site is the back, then the front. Occasionally can happen on the sides as well, but these are the commonest sites because where the weakest points are, and that is called an anal fissure. It's like a cut or a split. And the classical symptom of it is like razor sharp pain in the bottom end when we go to the toilet to do poo. Because it's a cut or a split, we can also get a little streak of blood from it. However, the main symptom is pain when we are passing our motions. So what is the treatment for anal fissure? The treatment for anal fissure is, when the split happens, it's so painful that the bottom end goes into spasm, becomes very, very tight, and that needs to be relaxed. Once relaxation takes place, then the fissure tends to heal, because as muscles relax, the blood vessels coming to the muscles, they can supply more blood to the damaged area, and it tends to make things heal. So blood is very important to make things heal. If we are in so much pain when we go to the toilet, the bottom end becomes even tighter. So what is the treatment for fissures? Vast majority of fissures heal on their own. So if the patients are given laxatives to keep the bowel soft, so it's not stretching the bottom too much, and painkillers which do not constipate. So don't take codeine or something like that, which is going to make you constipated, and again the bottom will stretch and cause more damage. So simple painkillers like paracetamol or ibuprofen or Nurofen or something hopefully will control the pain, and with the laxatives, the fissure in a few weeks time or a few days time will heal. If however it does not heal, the reason is because our bottom is very tight. It's either because the pain, it goes into spasm and we can't make it relax. If we can't make it relax, the blood supply does not come to the fissure and does not let it heal. So that spasm needs to be taken away. And one way of taking the spasm away is to give some creams. And there are two different types of creams which are usually used. One is called GTN, or glyceryl trinitrate. You might know there's some patients who have angina. They spray this under their tongue. It's made out of the same stuff but in a cream form. And the second is called diltiazem. Is the same stuff some people use for blood pressure as well, but comes in a cream form, different strengths than the blood pressure tablets. So please don't take the angina spray down the bottom end or take the blood pressure tablets to heal the bottom, because it is not going to work. The dose is totally different, and the preparation is different. So cream is applied slightly on the inside, not too far in, just slightly at the entrance, slightly on the inside, not on the surrounding skin either, and applied twice a day for 6 to 8 weeks. And if it's an early fissure, which means it's been there only for last few days or few weeks, then the chance of it healing with applying the cream twice a day for 6 to 8 weeks is very good. Almost 85-90% of the fissures will heal. If however the fissure has been there for a long time, for months or even years, then the chance of success with the creams and these measures is very limited. It will not work. Please remember, if one uses hemorrhoid treatment like hemorrhoid suppositories or creams over the counter from the doctor for a fissure, they will not work. A brief word of warning: if one is using the GTN cream, the glyceryl trinitrate cream that I was talking about earlier, a patient will get severe headaches after applying the cream. So as soon as they apply the cream inside the bottom, within a few seconds they get throbbing headaches. So half an hour before they apply the ointment, they have to take some painkillers like paracetamol or something to control the headaches. But after a week or two, the body gets used to the cream and the headaches go away. So it's very important to persevere with the ointment, because we don't want the fissure to become chronic. If it becomes chronic, it will not heal with the ointments, as I said earlier. So persevere. The headaches will go away after a week, 10 days. You won't have to take any painkillers, but keep applying it for 6 to 8 weeks. If fissure becomes very chronic, which means being there for a number of weeks or number of months or even years, then the chance of success with the medical treatment like creams, laxatives, painkillers is very small, because the fissure gets scarred and it does not heal easily. It's so very painful for a long time. Or if the bottom is in too much spasm and the creams, etc., is not working, then again the fissure will not heal with those treatments, and those patients will require surgery. Now there are different types of operations available. I won't go into details of them. So one of the treatment is Botox injection. Both these operations are done under general anesthetic in the hospital. They are day care operations, so patients come and go on the same day. So patients are put to sleep and Botox is injected in this muscle around. So Botox, as you know what it does, it paralyzes the muscle. When it paralyzes the muscle, it takes the spasm from the bottom away, so bottom becomes a bit relaxed. When it becomes a bit relaxed, the blood starts coming in easily and the fissure tends to heal. Quite successful treatment, and is the newest treatment which is available at the moment. In some patients that sometimes does not work, and an old-fashioned treatment in which one of these muscles is cut So again, the spasm goes away. None of these operations are risk free, obviously, because the infection can happen in there. And when the muscles are too weak because of cutting or Botox, then patients can become incontinent, which means they can leak poo. With the Botox, it's only temporary because Botox injections, as you know, only work for a few months. But leaking poo or bottom becoming too tight with the cutting of the muscle is obviously a problem that can happen in a small percent of people. So that was the summary of what a fissure is, how it presents, how it's treated. If you have any question, then please feel free to write in the comment section, and I'll be happy to answer you the question the best I can. Thanks again for watching.